Good afternoon, everyone. I'm Jody Hanson. I'm Director of Public Affairs and Communication for Johnson County Government. With me today is Dr. Sami Ariola, who is the Director of Johnson County Department of Health and Environment. Also have us with us back today, Elizabeth Holschuh, who is the Director of Epidemiology. Welcome back, Elizabeth. And then Allison is here today as our ASL interpreter. So thanks so much for joining us. Dr. Ariola, I thought we could always, like we always do, just hear how this week's clinics are going.
Thank you, Jody, and good afternoon, everyone, and welcome back, Elizabeth. Yes, the clinics are going pretty well. We have been running clinics at both Oakland Fieldhouse, which has been largely for those that are due their second doses, and today we did give out 1,224 second doses at Oakland today. And of course, we have been running clinics at a new location in Lenexa that's largely for first doses. And today the appointments were opened for 1,800 persons. And just like yesterday, we vaccinated exactly 1,614 persons today on both days, which again very important for our residents. If you book an appointment, to show up as much as you can. Now, if you have been vaccinated, that's great. Or if something comes up that you can't make it, that's okay too. But so collectively today at both locations, we vaccinated just under 2,900 persons, which is really good. Now the clinics at Oakland continue tomorrow and Friday, and again vaccinating, I believe both days, slightly over 1,300 persons are going to be due their second doses and being vaccinated. There are a few individuals that are due their Moderna doses also that we are walking into the clinic on Friday. And so if you are due any of those, you'll have Moderna, you'll have received information from us and know to be there. On Saturday, we are partnering with Heart to Heart and vaccinating our utility workers in the county. And so the companies have been working with Heart to Heart, and they are sending out the information to their workers for vaccination. And we want to make sure that the public is not showing up. I said that to emphasize the collaboration that we are having with Heart to Heart, and I think there'll be more information coming out. We just finished a meeting with our health systems, and really encouraging to see how virtually all of them are working to enhance the capacity that they have to vaccinate, which is very encouraging. And we're doing the same thing. Beginning next week, our goal is to give out a minimum of 10,000 doses a week. Next week, we're actually approaching 1,100 doses that we'll be giving out. We have right now clinics that's going to run from 9 to 7 on Tuesday, and the target is to give out 3,000 doses. We have clinic that will run on Wednesday 9 to 7 and Thursday 9 to 7. Each of those days, we are going to be giving out, the goal is 3,000 doses. Of course, it's a combination of first doses and second doses. On Friday, there will be a small clinic that's giving out second doses for those that are due, mostly Moderna. Again, if you are due your second dose on Friday, we will have reached out to you. And then on Saturday, we're going to be running clinics there from 9 to 12 a.m. From 9 to 12 on Saturday to also give out vaccine. And so so next week, you are seeing why we really like the new location. Not only are we extending week hours till 7, that allows those who are working from 8 to 5, who otherwise until now would not have been able to come, but you can come after work to get vaccinated. And also the Saturday option is there. And so we're very, very excited about that. Collectively next week, for the second doses that are due Tuesday, Wednesday, Thursday, and Friday morning, those are about 4,000 second doses that we are going to be giving out. And at the minimum 6,500 first dose appointments is what we have opened up this morning. And later, Elizabeth is going to come and talk about the new system that we did a soft launch for today in terms of booking those appointments. But I do want to emphasize at our clinic, lastly, and I have said that before, I do want to acknowledge the cooperation that we have received from Salvation Army in all of our clinics for several weeks. And I don't think we can say that enough. Every one of our clinics, they have been there giving out food and drinks to not just our workers, but to people that are there to be vaccinated. A tremendous example of collaboration, tremendous example of community pitching in everywhere they can to things that are important to the community. So kudos to you, appreciation to you. I hear that from staff. I hear that from residents all the time. So I just wanted to make sure that I mentioned that. And so I would let Elizabeth talk about the new appointment system that we have in place, and maybe talk a little bit more about appointments next week.
Great, thank you, Dr. Ariola. As he said, we did a soft launch today. We have been using the same scheduling system, both for our testing as well as for vaccination clinics since the beginning of the COVID-19 pandemic. And, you know, with all of the intricacies around the vaccine clinics and inviting people and filling up those appointments, we realized that we really needed to move to a new system. One in particular that let us invite people where the link couldn't go live, so it couldn't be shared, because we saw a lot of issues where we would try to invite, 65 and up population, and then the majority of our appointments that were taken were from under 65. And so this system, we're trying it out. It was a soft launch today to see if we had any bugs that were going to come up. And what's unique about this is we are still sending email invites. And it will have a link in there, and individuals have essentially been pre-registered in the system. So then they just need to go in, follow the link. And what's really important is that they enter their date of birth exactly as it's listed in that email. And then with that date of birth and either your first or last name, you will be able to get into the system and book an appointment. The other really nice thing about this new process as well is that it allows residents who we send invites to let us know they've been vaccinated. And that's something we haven't had yet, where previously we would maybe invite 5,000 people and we would only have 2,000 of them fill out the appointments. Are those other 3,000 people who can't come this week? Are they people who've already received the vaccination? And so now there's a link on there. If you get this email and you've already gotten your vaccine somewhere else, you just click on that link, and that's really helpful for us to know you've already gotten it. So each week, or every time we invite a new group, we will be sending out these emails. Again, it will have your date of birth in there as you put into our interest survey and your name, and you can follow the link and sign up for an appointment. Now, if you can't get an appointment for some reason, maybe you're out of town, maybe you're in quarantine, you can't come this week, we will invite you for the next several weeks as well to provide an opportunity, as long as you don't click, I've already had my vaccine. And so this will allow for people to be consistently invited to get that appointment without those appointments being taken up by other individuals. And so we're excited about this. I'm sure it'll be a learning process, as this all is. I would tell people though, if just check your junk mail every so often. Some of these emails are going into your spam folder, your junk folder. So take a look, and we will be moving through that list. I know that we sent, I believe, 7,200 emails this morning, and about 1,500 of them actually got returned as saying I've already been vaccinated. So that's really valuable to us. We won't have to keep inviting people, and we know that we can then remove them from our pool of individuals who we think still need the vaccine. And so that'll be great for us moving into next week. So yeah.
And thank you, Elizabeth. So again, we have a new system. It allows us to plan and know who is being invited. It allows us to use the data that we have from completion of the online vaccine interest form, and we are moving down our list for appointments. I guess the key thing to keep in mind is next week at our clinics, there are literally thousands of appointment opportunities that are available. and we're moving down our list. Now, it's a little bit different than in the past where the link is there and you can just go and click on the link. Now you have to wait to hear from us and get the link. So if you have not yet completed the online vaccine interest form, now is the time to do that. But also, like Elizabeth said, please check your junk mail folder and make sure you respond to those appointment opportunities as quickly as you can. But also just left a meeting with health systems who are other providers, and several of them are increasing appointment opportunities. They are making appointments available to everyone, not just their patients. And so, and as we're getting more vaccines coming to the county, tremendous opportunity to get vaccinated, tremendous opportunity to get vaccinated. So again, we've reached out to 7,200. We know that we're going to have to reach out to more people to fill the appointments next week. So again, check your email folder and respond as quickly as you can. And if you have been vaccinated, click on that link. Let us know. It makes Elizabeth's job a lot easier.
So, like you said, 7,200 you sent out, you heard back from 1,500. So you plan on sending out another batch. Is that going to happen today, tomorrow? Do you know yet when that next email is going to go out so people know to look for it?
So you're right. We sent out the first batch of emails this morning, and we'll send out the next round tomorrow morning to give some people some time to fill that out and check their email. Maybe they haven't had a chance to check their personal email while they've been at work or something. So gives them a little bit of time. And again, if you get the email and by the time you're able to get in, there are no more appointments available, we will send you another email as long as you haven't told us you've already been vaccinated. So stay tuned.
And to be clear, we have heard from more than 1,500. The 1,500 are people that said have already been vaccinated. There's others that have booked appointments there. So.
And then just to confirm this, so let's say I get that email and I've already been vaccinated, but I know my best friend hasn't. So I forward it to her and say, hey, you should sign up. That link won't work for her. Is that correct?
Correct, because it's associated with the information that you included in the interest survey. So it's going to be associated with your name and date of birth. And so again, the key piece is that date of birth as it comes through in your email. So when you get that email, it will say, here's your date of birth. So make sure you even copy and paste that. And then the name, as long as the first name or the last name matches what's in our system, you can get in. And if you run into problems, please feel free to call our hotline. If you get that email and you can't seem to get in, call our hotline and we can certainly help walk you through and figure out how to get you an appointment.
And overall, did it seem like that new tool worked? I mean, from what you could tell, did it seem like a good solution?
Yeah, we had people booking. I know it's already easing some of my team's minds and stress level. So, you know, I'm sure as time goes on, we'll probably find some glitches and some places to improve it. But yeah, I think it's a really great move as we move forward to ensure that people have the opportunity to get vaccinated.
I know one question I've seen come through maybe emails or different places. I see a lot of people bringing up different scenarios about why they're having trouble getting their second dose, where they got their first dose. I saw a media report about Walgreens, for instance, and I know I've seen some emails where somebody was in another state. So I guess, can we just kind of reiterate, I know we've talked about it before, but just let people know what they should do in that situation and why it's so important to get your second dose where you got your first dose.
Right. So the ideal thing to do is to get your second dose where you got your first dose from, and we cannot overemphasize that because the second dose that we receive is based on the first dose that we are sent. So if we entertain too many second doses that did not get first dose from us, it would disrupt our plans and how our vaccines match eventually. So what's going on is some people, even within the state, are traveling quite a few distance to go and get the first dose, and then hoping that they can get the second dose here. We are keeping track of the request, and we have done our best sometimes to try to meet those needs as much as we can, but there's only so much we can do. And so if we see, for example, an older person who was in Florida for vacation, get their first dose there, that would take priority for us over somebody who drove down to a rural county in Kansas. And so if you are able to go back there, that's what needs to be done. We cannot guarantee that we can consistently meet those. We are continuing to do our best, but our primary plan is, as we are giving people their first dose, we're telling them to show up at the same location at the same time for a second dose. And our plans are around the first dose that we give out. And so, again, our message remains the same. Get your second dose from where you got your first dose from. And I read the story about Walgreens, and I think it's probably a software scaling issue, but they do have the second dose, and you just need to reach out to them.
Okay, great. Thank you very much. I'm monitoring Facebook, and I'm actually not seeing really any questions. You guys must have covered everything today. Is there anything else you wanted to share before we wrapped up?
You know, Elizabeth is back, so she covers all the questions ahead of time. So, look, the key points that we have a new system, gives us better control over sending out appointments and tracking who has an appointment, who has been vaccinated. That's a good thing. But like Elizabeth also said, we can only reach you if you complete the online vaccine interest form and complete it accurately. As if you leave phone numbers, we are reaching out to you, either calling or sending text also. But those information, they have to be accurate. But also check your junk mail folder to make sure that you don't miss those opportunities. Again, if you don't respond, we'll still have you in our system, and we'll keep reaching out to you, at least for a few weeks after that. And I do want to acknowledge our DTI group, Bill Nixon and his team, for their efforts. We've been working on this for several weeks, trying to figure out how to improve our appointment booking system. And I think we finally found a way to address some of the shortcomings. We are fully in phase 5. We moved along with the governor's guidelines. And if you are a resident, if you are 16 plus, you qualify for the vaccine. And our team is going down that list. They are going to be shooting out more invitations tomorrow morning, because we want every one of those 10,500 plus appointments next week to be filled. But I feel very confident that almost a similar number of appointments are available with our other providers. Actually, a little bit more when you count the pharmacists. We spoke with 2 of the pharmacists last week, Walmart and Hy-Vee, and both of them are looking for opportunities to expand. They are going to expand to all of their branches in Johnson County. I think one was expanding from 7 to 11, and the other was expanding from 3 or 4 to the entire 6 branches that they have. And so those are additional opportunities, avenues to get vaccine. And we have been working with private providers. Last week, I did mention that KDHE was going to send us 1,000 doses of Moderna this week that we're going to send to private doctors to also give out vaccine. They actually doubled that. So we are receiving 2,000 doses of Moderna. And this week, Elizabeth's team has been reaching out to those providers, finalizing the logistics. How many can you handle? How do we get it to you? So again, I feel very excited that not only are the existing providers expanding capacity, we're bringing in more avenues to distribute the vaccine in the county. So as we get more vaccines into the county, our goals remain the same. We want to distribute them as we receive them. And it's looking pretty good that we'll be able to continue to do that.
Great. Thank you so much, Dr. Ariola. Elizabeth, great information as always. Allison, thanks for being our interpreter. And thanks for those who are watching, and have a great rest of your day.